Good morning, everybody. Welcome back here at ESCMID Global TV. I am your host, Judith Cohen, and unfortunately, we have already reached the final day of this year's ESCMID Global 2024. But on the upside, we still have a day with lots of very interesting interviews ahead of us. For that, I would like to introduce my next guest, who has just joined me here live in our studio here in Hall 8.1 at the Conference Center in Barcelona, Spain. And my next guest is no one less than one of the keynote speakers who will be speaking today at 11 o'clock in Hall A. And this is no one less than Professor Per Ljungman, who is Professor of Hematology, a senior physician at the University Hospital of Karolinska Institute in Stockholm, Sweden. So a very warm welcome to you, Per.
Thank you.
Very happy to have you here. At 11 o'clock, you will be holding your keynote lecture on viral infections after stem cell transplantation, a lifetime journey. So it would be really interesting if you could have a little chat with me and share some of the details of the talk you'll be giving with our viewers. So a lifetime journey, is it your lifetime journey with the viral infections, or is it for the patients?
If it was for the patient, it's a very good question, but the way I'm going to talk is on a personal lifetime journey,
Right.
which is then 44 years in working on viruses after stem cell transplant. But of course, and I will also say that on one of the last slides, is I'm a clinical researcher, and whatever I've been doing is of course not possible without the patient and their families. So that's sort of the overreaching goal to reduce morbidity and even mortality in viral infections to benefit the patients.
Yeah. So looking back in 44 years almost of doing research in this field of interest, have the types of viral infections that occur in patients after stem cell transplantation changed over the years? Have you seen any changes or?
The answer to that is both yes and no, because when I started, I didn't participate in the first transplant being performed at Karolinska because that was 5 years before I joined the group, but that patient died from cytomegalovirus pneumonia, and that was the big fear in those early days of transplant. And cytomegalovirus have lived with me, and I worked with it ever since and still do. So it is still a challenge, but in a bit of a different way, because we are not doing transplants the same way, of course. No therapy is done the same way 2024 as it was in the early 1980s. And that means that the risk of the patients changes. Some things that we did have, of course, disappeared a long time ago. Other things have been introduced. We are doing things that we would never have thought would be possible in the early 1980s. And unfortunately, that increases the risk for infection. So that's one of the old foes, so to speak. But then we always meet new challenges, and I can only mention the word COVID, which of course is going also to be an important part of this presentation, although the pandemic is over and we are hopefully getting out of it. But I don't know if SARS coronavirus 2 has played its last trick on us yet. I think that time will tell. And there will be new pandemics.
So the post stem cell transplantation patients is a very vulnerable patient group, of course, or population.
Yeah. So the first analysis we performed with help of the so-called EBMT registry, we showed a mortality of almost 30% of the stem cell transplant patients in COVID. We had a group of CAR T-cell patients, which I'm also worked with, that had a mortality of almost 55%.
Yeah.
But this was back in 2020. And so, yes, it's a very vulnerable group.
Yeah. What do you feel is the largest challenge in this patient population regarding viral infections?
It's in the patient's immune system itself, because the risk factors for viral infections are very tightly connected to immune reconstitution, because in the allogeneic stem cell transplant setting, we are changing the patient's immune system to the immune system of the donor.
Yeah.
And that so-called immune reconstitution looks very much like, in some phases, what happens in a newborn baby. You have to learn to tackle a lot of challenges, particularly viral infections.
So what is the best way to manage that? Is that just supportive care, or are there other therapeutic agents available, or in the pipeline even, maybe to help guide them through that phase?
The word supportive care is a very broad term. So, of course, the answer would be supportive care, monitoring for infections, prophylaxis against infections when we can, try to help the immune system by having as low grade of immunosuppression as possible, vaccinate against infections where we have efficient vaccines. So there are many ways we can do it, and we employ all of these.
Yeah. And during the phase of immune reconstitution, as you call it, do people need to be in isolation, or how does that work?
The answer is not really any longer. In the early 1980s, we had patients in very strong protective isolation. We call it bubbles, but that is long gone from all transplant centers, because we realize that the patients need to develop specific immunity, and they can, but of course they have to take care. They have to
sort of watchful exposure.
Use protective measures. We try to say limit you don't have to call a party with 20 people. Take care, isolate yourself as much as possible at home, but go out, live, because people must have a quality of life. So, but of course, when COVID came, and then many went back into a bubble, and because the risks were so great. So
but with them, a large part of the world population also.
Yes.
So,
but I remember I come from Sweden, where we didn't. So.
Oh yeah, exactly. Yeah. Well, I came from the Netherlands. We all were also isolated at home. Yeah. So are there any advances in the therapeutic area that are worth mentioning, that you know of?
Yes, absolutely. I started talking about CMV, and after having tested a number of different possibilities to prevent and treat CMV, about 6-7 years ago now, we got a very efficient prophylactic drug that's now available for general use, that also has some nice aspects to it. It has low rate of side effects and can be given safely to patients. And that has definitely reduced the risk for CMV. If we go back in time, one of the first things that came in the 80s were another antiviral drug that prevented herpes simplex and varicella zoster infections. So yes, definitely. But there are also areas, particularly for respiratory virus infections, where we don't have efficient antivirals. Adenovirus, not also a bad infection, particularly in high-risk children, and we don't have a good antiviral. So it's mixed.
Yeah. And is this patient population of vulnerable post-transplantation patients, do you need to vaccinate them for everything that there's a vaccine for? Is that necessary?
Yes, you need to
Yeah.
revaccinate because they lose their pre-existing immunity.
Yeah.
So you have to revaccinate
So, yeah.
for
For
going
everything.
going out of the viral area to, for example, against pneumococci, which of course are bacteria, but we also revaccinate to polio. So
Yeah.
influenza, COVID, of course.
Yeah.
But now we are seeing an old challenge coming back, and that is measles. Measles is a live vaccine, so you cannot give these patients a live vaccine early after transplant. So
that sounds tricky.
That's tricky.
Yeah.
We can do it safely when the immune system has recovered quite a bit. That was one of my early publications.
And how long is that period before?
Well, one of my early publications was that we could do it safely at 2 years after transplant if immunosuppression was out. Now there has been in outbreak situations vaccine given at 1 year after transplant, but it is sorry.
No problem.
It's always a balance when you give live vaccines, what is safe to give and when.
Yeah. Yeah, so you're always weighing what actually helps the patient.
But this is the typical situation we always are in with these patients. We have to balance risk-benefit for everything, basically.
Absolutely, absolutely. Well, thank you so much for coming here and sharing us a little bit of what you will be talking about later on with our viewers. Thank you. Thank you all for watching us. If you want to hear in more detail about viral infections after stem cell transplantation, please make sure to join our keynote speaker, Professor Ljungman, in Hall A at 11 o'clock. Don't miss out. We will be taking a short break here at ESCMID Global TV, and we will be back at 10 o'clock when we will be inviting the new ESCMID Education Director, Mary Horgan. So we will be talking a little bit more about the direction the society is heading towards regarding education. So tune in with us at 10 o'clock. See you then.